There it is.
Oh my lint. That is brutal.
Mm-hmm. There it is. A little bit. Yeah. Yeah.
Whew.
Yeah. That bone is not moving in a while.
Yeah. That's a two-step, man. That is crazy.
Lower neck inflammation is extremely common, and it's extremely common in a world where we're predominantly rounded forward, our heads are forward, nobody's really teaching us about alignment. Heck, even chiropractors are just adjusting bones and putting people on lasers, electrocuting people. We're not trying to ultimately get our ear over our shoulder. Our head weighs about 10 pounds, and when the more forward our head goes from our shoulder, the more our muscles are working harder, the more the discs in the spine are under more pressure. Lower neck joints, when they're inflamed, will give you pain here. The nerves, when you're hitting the nerves here, will cause contractions here. So there's a lot of overlap. The roots of the neck are also there. So if you think of the neck like a trunk of a tree, as the head goes forward, the roots start to pop up there. So, and I work it down, but it's a postural spasm, right? Maybe it's a, you understand, just the head being forward makes it contract simply because your head's forward. And so until somebody guides us to get our head back, that muscle contraction is going to be there forever. It won't go away, and that's probably what you've been seeing over the last 7 years. I work it, and it comes right back because we're not getting to the root cause. Thoracic outlet is the channel with which the nerves that leave your lower neck go to your arm. Mm-hmm. So generally when we're talking about thoracic outlet, it's going to be hand symptoms, arm symptoms, radiating symptoms down the arm, which isn't that. It doesn't mean that we don't have pressure on the nerves in the lower neck going to that area, but the way we alleviate thoracic outlet is one, the ribs in the upper back, when they rise up, they pinch the channel. There's like a channel here, and the ribs coming up from the bottom, the vertebrae in the neck going posterior. So when our neck has a curve in it, the bones are more forward. When we tuck our chin, the vertebrae go backwards. And so that presses on the upper part of the channel, and then the actual tissue that the nerves are traveling in can become inflamed by muscles, soreness, and lactic acid. So it's not an opinion. The thoracic outlet is like saying, I don't believe that we have a heart. You know, it's like it's anatomy. You understand? There's an anatomy where the brachial plexus, which is the bundle of nerves that leave your lower neck, have to travel through this funnel to get to your arm. Now, maybe what they're saying is we don't know if it can get pinched, or we don't believe in the way mechanics of how it gets pinched, but the anatomy is the anatomy. Now, when you lift your shoulders up or breathe in, the ribs rise up, they pivot. So this guy right here, we obviously don't have the full model, but the ribs are connecting onto that wing right here. So right here is the funnel. The funnel would be like the rib makes the lower part of that. So imagine a rib lying right here, and then all these wires are having to come through this conduit. Now this vertebrae goes backwards, right? That's going to start pinching on the opening of that funnel, and then you have your muscles over top here. Mm-hmm. This model's missing a lot of pieces here, right? But we have to envision all this tissue in here, and then the wires are traveling to get down into your arm. Now, if this rib, when we breathe in, the rib comes upwards. It pivots upward and then downward. It's like they call it in school, they call it a bucket handle. So it rises up and then goes back down, but it pivots on this transverse process of the first thoracic vertebrae, and the more that rib stays elevated, the more it pressures the nerves as they're traveling in that channel. The rib is determined by head forward, head posture, the roots lifting up like I'm talking about, and injuries. When we get injured, we tend to shrug our shoulders, we go into a protective mode, and then we don't go back to our shoulders being down and back. You see people walking all the time, they just stay in an elevated, contracted state because of guarding. Not too bad, about an inch forward, about at least inch and a half forward. So we want the middle of your shoulder to be over the middle of your ear hole. So the ear should be lined up with the middle of the shoulder, a little bit head forward.
Something that you mentioned with the ribs. I've noticed that even pressing on the knot that I have underneath my shoulder blade has affected a point in the side of my ribs where sometimes it'll just start spasming, and I'm trying to rub it out to make sure it just kind of subsides and goes away, and then I find myself reaching over,
trying to stretch it,
and doing whatever I can to find relief. And luckily, in the last 3 weeks, I haven't really had any episodes, but
We'll fix that. It's just a dirty spine. The spine needs to be cleaned.
Yeah.
That's all that is. So you're getting irritation of the nerve. The nerves in the thoracic cage will wrap around to the front. So when you're pushing on the backside, you're going to feel it. It's like how the nerves in the lower back radiate down your legs.
Mm-hmm.
The nerves in the thoracic cage, they don't go down your leg, they go around to the front. So you're feeling a rib sciatica type of thing. It's just, the muscles are just, again, they're being hit because of all that inflammation in the back.
Yeah.
We just got to clean your spine, bud.
Okay.
We'll get you fixed up. Your whole torso's off. Give me a second here. Yeah, you're avoiding this right lower here. Yeah. Right hip's high. You're in, this hip is high. We have, when your body's trying to compensate and alleviate, we have pressure on things going down here. All right, the medical world and chiropractic world act as if the bone goes out of place and that makes it hurt.
Mm-hmm.
Right? I believe the exact opposite. I believe that it hurts and then it goes out of place. That you break your right ankle and now we shift because I have an injury that made me shift. Right? You're not standing correct. You're crooked. Correct. I got an injury over here that's making me avoid it. Right?
Mm-hmm.
Because they have believed the opposite of what I believe, they believe in putting the weight back onto the thing that the body is purposefully running away from. And I find that to not be helpful or beneficial and a good thing to do.
Yeah.
Well, how do I not be crooked? I'm noticing I'm avoiding my right ankle. Well, we have to help heal and repair that ankle. Then once it's no longer injured, I can use it again, right? It's only because it's been injured that your body's going to avoid. So I'm looking at posture, I'm seeing, essentially you're like this, right? Where something happened over here that made you get away from it. Like, well, I'm fine. No. Well, I don't have any lower back issues. Well, but you're in avoidance of something. And until it grows to a point where now, even though you're avoiding it, it's now grown so big that it's no longer avoidable. Now I'm feeling it. Well, no. It was a problem 7 years ago when you started avoiding it. But our world, again, we just react. We react to problems. We don't teach preventative. Look, the tire's not on straight. You're going to wear the tire out unevenly because it's not on straight.
Right.
Everybody's going to wait till the tire blows and then say, oh, the tire was not on straight. No.
Right.
When you started seeing the tire wear out unevenly and started seeing the car pulling to the side, that was when it should have been fixed. Take one deep breath in. Relax your chest. I got you, bud. Relax your chest. Head back. All right, deep breath in. I got you, bud. It's okay. Head back. Exhale. Relax your chest. Yeah, deep breath in. One more. Exhale. All right, yeah.
Yeah.
Put the back of your head there. You go. Perfect. Take a deep breath in for me, and then relax your chest. I got you. You're not gonna fall. I got you. Yeah, way too tight here. All right, breathe. Exhale. Exhale. All right, that's everything good. Just in case I'm not around one day, nobody adjust your lower back. Let's leave that alone, right?
Okay.
So what are you doing here, Ed? We're trying to adjust the joint below your lower back, right? I'm not adjusting here. We're trying to adjust the SI joint and the joints above.
Okay.
Okay. Take a deep breath. Exhale. I got you. Exhale. Oh boy, really tight. It's okay. Face that for me. Yeah, way too tight. Yeah. Yeah, you're a lefty. He's a lefty. I thought something like 85% of my patients are on the right. It's always the bumps on the right. Yours is, you got a left injury here. I wonder if it's sometimes birth traumas or how we enter this world.
Right.
Yeah, yours is right here on this left side, right there. He doesn't want to compress. This knot here,
Yep.
right there. That's huge.
Yep.
Now look over here. It's nice and soft. There's nothing. You see the
Mm-hmm.
right side's all smooth, and I got an injury. That. We'll fix it. We'll fix it up for him.
Appreciate that.
But it's like a band. It's like it's a constantly contracted band right on his side of his atlas.
Yeah, and it was hard to try and work with a pool cue.
Mm-hmm.
Yeah. On self-inflicted.
Sure, it's okay. That's why I get paid the big bucks. That's why. Here we go. Easy. I got you, bud. It's easy. There we go. Oh, it's okay. We'll go deeper in a second. Yeah, we'll get it. Oh, I know.
Oh my lid.
I wanted to see how it moved cold. Why didn't you massage me first, Ed? I think I would move much better if you spent 10 minutes massaging my neck before you adjusted me. That's true, but I was examining it at the same time, right? I wanted to see how the engine. I jumped in the car and I turned the key. You understand? I didn't prime the fuel pump. I didn't. You understand?
Yeah.
I just wanted to see what it looked like a cold start, and it's about what I thought. I have a non-functioning left atlas. There, that knot is huge. I'm sorry, nobody's. I mean, you can. I think Carl, you can almost see me running over it. It's like right there. It's a pretty large, substantial knot. The shoulder blade is just the effect. That's the source, cause, effect. I think a movie my wife hates is The Matrix. He's like, I drank too much. Now I have to piss. Cause and effect. Wow. Your head doesn't want to go left. Got to get off that right side. No sleep on that right side. If you can fast from sleeping on the right, got to get. There's two traumas. There's actually two. Wait, I'll show you. 1, 2. You feel it?
Mm-hmm.
He's got two dents. The other one's smaller. The large one almost makes the small one look. I missed it first.
Mm-hmm.
Oh, I missed the second one. The second one's in there, but it's much smaller. Yeah. So then we just comb it. So the areas that are tight for a long period of time choke off their own circulation, so they don't have good oxygen blood flow into the areas, and so they actually muscles need oxygen to contract. They also need oxygen to relax. So this is part of what the gua sha does. Is it now helps to hydrate the tissue, brings that oxygen in, and allows the tissue now to not have to be continually spasmed. Right. So it's
makes sense.
you do have to go in there and break the cycle, along with fixing the reason for why it happened in the first place, but. There it is. So everybody at home can see it. There it is. There's his injury. I got you, Ed. I got you. I'm waiting. Let it go. Here. Let it go. Almost there. I'm sorry. Come on, bud. I'm waiting. Wow. I got you, bud. All right, I'm done. All right, it's tight. This is smooth
Sailing
on the right side of your neck. I'm almost done with it. I would almost focus a month just on your left side. That's how asymmetrical it is. And there's nothing here. That's how it's supposed to feel. Yeah. Now the right side's going to be the abuse side. Eventually, you're going to destroy this side because the left side is so locked and avoided. But the right side is going to be called the compensated side. The side will be where all the bombs go off, but right side's only doing it because this is where the problem is. The distance is so far. It's like Tom Brady throwing a football through a tire swing 50 yards away. Do you understand? Mm-hmm. On the right side, it's only 10 yards away. It's an easy throw. You understand? It's an easy adjustment. The left side, the distance, what we call subluxation, is so large that the adjustment required is much more difficult. So I try to walk you closer to the tire swing, so it's not such a large throw, but at least now you know where to work. Yeah. It's this left upper side. It needs to be compressed for like an hour or two, and then attempt to be adjusted again. That makes sense. But it's like it's so filled with fluid, I can't compress the fluid out of the engine. It's like water's not compressible. It has to be squeezed out of the joint.
Yeah.
And it's so swollen on the left. Yeah, wow. Right there. Big knot right here, right?
Yep.
Not so much there. It's right here. All right. My new seminars, I titled it, "It's Not Your Fault." And I say it's not your fault because life was it's like we had a new car and a really nice warranty that came with it, right? And all our problems that we had were taken care of automatically by the the dealership. And then once the warranty ended, now all of a sudden we're realizing that, hey, I have to pay for all these things? We didn't realize how easy we had it.
Yeah.
We got injured, and it's never hurt to turn my neck before. Why would I ever expect it to start hurting? It's never hurt to do things, and now it does. And, yeah, I mean, it's just. These to me are more taserings. This doesn't feel like an injury in here. This just feels like nerve pressure, postural tension. Do you understand?
Yeah.
I don't have a lot of crunchiness. I just have tightness, but I don't have. This feels like an injury. You understand?
Yeah.
That's an injury. You got whiplashed or fell or something hit you. That's an injury. This is just compensatory tightness, postural change that creates tightness. But I don't have a lot of crunchy. See, when we have muscle fibers or ligamentous fibers, when they get injured, they heal in a ball of yarn. They all started off very organized, like railroad tracks.
Yeah.
And then when it gets injured, it heals very disorganized, and that's what I feel is a crunchy knot. That's where it's been torn. I don't feel any tears in the fabric in here. I just feel immense tightness. This right here being here is going to make you overwork this. This
Yeah.
gets damaged. Because that's stuff. These feel a little crunchy over here.
Yeah.
These are more like injuries. These are probably more compensatory injuries. This just feels tight. This has like a little bit of a, however you want to describe it. Get all that little graininess. Like right here. This has like a grainy, crunchy. It's like I watch those car, body shop where they take the paint off and then you can see like the Bondo work.
Yeah.
It's all hidden by paint, until you sandblast the car. Then you see all the, oh yeah, that's where it got a collision that was repaired. Yeah, that's been collided with. A little bit right there.
That is brutal.
So I take it nobody's found these either.
No.
I take it nobody's showed you these.
You are correct, sir.
What do we do? Here, click, 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 click. You check your muscle strength. Get in here and clean his back.
Yeah.
You know, this is what wraps around to the front. Remember earlier you were describing, like when I talked about cleaning your back?
Yeah.
You're saying this is dirt, for lack of a better term. You know, this is inflammation in here that needs to be cleaned out, and then teach you how to not let it build up so much or very quickly. Get that going. We're going to put a roller here in a minute. There's a foam roller. We're going to use that right here. You're not going to like me.
Ugh.
And we've got to get pressure, and the peak of it's going to be right there.
Need to be put back together.
Body
again.
shop.
Yeah, like Mr. Potato Head or something.
I love Mr. Potato Head. Put his eyes on top of his head. Put his ears in his mouth.
Damn. Oh. Hey, do you mind if I adjust for 1 second?
Yeah.
Okay.
Yeah, it's really because, like I said, because the head's tilted to the right, this is being pulled on all the time. Do you understand?
Mhm.
We got to have your head back and left. Because your head's forward, not just forward, but it goes to the right, these roots are being pulled on more. This is gonna, like I said, we're gonna nip this in the bud, but this was coming. This guy right here was.
I can feel that is
Mhm.
gnarly.
Mm-hmm, mm-hmm. You know, like the teeth, until the cavity reaches the nerve root, we don't have much awareness of it, right? And the
Mhm.
decay takes years in a tooth to, from a small cavity to a large cavity to now it's hitting the nerve root and causing a toothache. So it's the same kind of thing with disc injury. There's very little to no awareness of it until it gets to a certain threshold of damage.
Have you been cupped before or had gua sha?
Yeah, I've had gua sha before, and I've had cupping once and acupuncture once.
Okay.
But definitely, I don't know, when I started following the page, just the way that
Yeah.
you were describing things, it just made sense.
Yeah. Excellent.
I had never heard anyone talk like that before as a chiropractor, so
Mm-hmm.
kind of gave me the
I'm glad you're here.
encouragement
Glad
to
you're here. Yeah.
make the trick.
Set you up with tools and give you some stuff to, at least to know how to treat it. And ultimately, the head's got to not tilt to the right. You're saying if that's not treated, this won't ever go away.
Yeah.
This is an effect of that. It's all the gnarliness on the left side of your neck, and it takes a number of treatments to get that. I got as best adjusted as I could today. It needs, like I said earlier, it needs stretching, compression. See in a couple days, we do it again. You understand? In
Mhm.
cycles of You ever have like a plate with the food so caked on that you're like break a nail trying to?
Yeah.
That's what it is. It's like it needs like I need to like let it soak for
For a week.
so I'm not gonna break my knuckles trying to scrape that plaque off that. It's so caked on. But once your head doesn't desire to tilt to the right, this will start to go away. This is just the effect. There we go. This is the crunchy side. This is definitely. You feel that? There's a nice little boop, boop.
Mhm.
Feel that, dude?
Yep.
Yeah, you got nice. This is a trauma. I don't know. Either because you're in left avoidance and you're in right jamming. Anytime you have compression, this is where all the pounding. Do you understand? This is where all the joint stress is on. So I don't think this was. It wasn't like this area was just this is where all the force was going. You know, you run or bicycle or trip. This side's doing 70%. This is doing 30%. So all the injuries are going to mainly happen on the right because you're in left avoidance.
That makes a lot of sense.
Yeah. Right there, it's all. Ooh. See if you can see all this. With the peak right here, that's where it's getting softer. But yeah, it's pretty gentle. I'm not like I'm going crazy. It's for people view this sometimes. Stop ripping his skin off. It's how would you? It feels
No,
good.
this feels good. Yeah.
This is the easy part. The elbow part was the.
Yeah. If you had the camera on my face,
Right.
you've been able to tell.
This is the soothing part. Wow. Yeah. This got a lot over here.
I feel a lot of clicking right there. Yeah.
Mm-hmm. Got a nice injury right there. See the difference in the color right there is a nice injury. Right. You almost got to see the knot. I put you on your side. It's like I'm asking the finger to bend. You're saying I took your finger and tried to bend it, and the finger didn't bend. You understand?
Yeah.
It's like, well, you're hurting that joint, Ed. No, I'm asking the joint to do what it was meant to do. The joint is meant to bend, and it hasn't bent, or it's been injured, and now it's ceased to bend properly. And so you can live the rest of your life with this joint not functioning, and this joint itself will be happy. It's on vacation. It doesn't work. This guy's going to suffer. Right? You're saying
Yeah.
the lower back's going to suffer because nobody wants to be mean and go in here and restore the function of your sacroiliac joint. Very powerful joint, very necessary joint for the overall health of your lower back. Not good that it felt like a wall. You
Jeez.
can't. That's the joint right there.
We're about teamwork, right?
Teamwork. We're all about teamwork here. That's right. Yeah. I'll show you the right one's. The right one's going to be not too great either, but it's going to be less as intense as this side. This is the
Oh my.
right in there.
That is a pill, man. Whew.
I got some suppleness here. This is I call this the abused side. Your left lock, because the right side's abused, at least it works, right?
Yeah.
It's going to be abused. You're going to overcook it, but it does function. In terms of a massage, I would spend 80% of our time on this left side, right?
Yeah.
Until it balances out. Do you see how you can make what's loose looser faster than what you can make stiff looser?
Yes.
So if you just do an even massage on you, you actually can further imbalance you. That's the scary part. That keeps me up at night. Where you don't want it to look even. Do you understand? People might say, I feel like you rub the right side of the neck a lot longer than the left. Correct, because this isn't just a massage.
Yeah.
This is correction. Until you're balanced, it's not going to look like a very balanced massage. Right there. You got to get this left side working. All right. Can you keep that forehead to forearm contact for me? Okay, you're good. Yep, you're good. You're good, bud. Okay, relax your back as best you can. I got you. We're gonna arch up a little bit. Breathe. I got you. All right, you're gonna breathe for me. Try to relax your chest. Relax. I know, but it's okay. I got you. Breathe. Exhale. We're done. Okay. All right. Arms down for me. Relax your back. Relax your back. There it is. Yeah. Yes. It's like 80% of this will go away just by fixing that. You understand? And then there'll be some lingering that we'll have to go in here and clean, but a huge percentage of it is just relieved by getting the head onto the shoulders evenly. Now, symptomatically, we can make it feel better by cleaning it, but then what happens is depressingly, and it's back again a week later. You understand? Because
Yeah.
we didn't fix the cause of the head being tilted.
The root cause.
The root cause has not been addressed, and that is more difficult.
Yeah, dude.
Yeah.
Yeah.
You got some buildup back there.
Yeah.
Yeah, that's the knot down there on the left lower there.
That is raw.
There's where you're pushing. That's where you've been working. But all around, it's all.
Jeez.
Again, that's of course you're gonna have stuff radiating. And the nerves travel right from the spine through that all this
Sure.
dirt, and yeah, they're not happy.
That's
We got to get
incredible.
the spine clean. We got to get the roller. I'm gonna use a roller, foam roller. We're gonna use it lays across your back, and we're gonna. The goal is it has to be 20 minutes in order to change anything permanently. But the goal is to get to 20 minutes. Now, maybe not the first time you do it, but the care has to be aimed in that direction. If we're not getting to 20 minutes, you're not going to permanently change your posture. If you're not permanently change your posture, then this is all just, we're all just goofing around. There we go. I got you. You're good. You're good. I got you. Relax. Relax. Wow. Tight. Okay.
Did you pat yourself?
Nice. Well, it's kind of just. Yeah, that's right. Yeah, good job.
We pat ourselves on the back.
That's right.
Way to go, me.
Self-affirmation.
That's right. Took stuff off, but. There we go. Yeah. Yes. Score.
Try it for 5.
Perfect. Ankle. Oh, nice. Nice. Very nice. Very nice. Okay. All right, look straight forward for me. Relax your shoulder. Push your elbow back into my elbow. Back. A little bit more. Okay. Good. Let's see if I can get some of the shoulder stuff. Press back with your elbow. Okay. All right, go ahead and tilt your head to the right for me. Tilt right. Tilt your head right. Okay. Tilt your head to the right for me. Tilt right.
It's a new one.
Yep. Okay. Okay, keep your head straight for 1 second. Okay, I'll tell you.
So I'm getting eager over here now.
Okay, tilt left now for me. Tilt left. Okay, up here. Up, top, tilt left. There we go.
Wow.
So what you'll do is you drag your bottom. You do not lift your bottom, but you just drag it and you push with your feet, and you're going to roll upwards about an inch. Get the idea?
Mhm.
And you just every minute you're going to move 1 inch, either up or down. I do not want it in your lower back, so we're going to end about middle back area. So we have the whole thoracic cage. I'm going to use right, but yeah, got it.
Yep, that starts spasming again for sure.
All right, okay. All right, down here.
Yep.
Oh man.
Be careful with that bad boy. That's.
So sensitive.
It's been a pain for a long time.
Let's go a little higher. Let me go higher. Let me go higher. Let's go up. There we go. Get back on my gotcha. Let's try there.
Okay.
There we go. We're gonna need to go to that edge and then back off. You understand? That when that spasm starts to happen, you have to back off. And that's what makes it take longer, or you need more table work so that stuff doesn't happen. What's happening is we're actually, whatever injuries in there are being compressed. And as we get your back cleaner, that'll happen less.
Okay.
But it's because we have all that inflammation in your back that I just stirred up, but it's still inside there, right?
Sure.
And as that dissipates, the spasms will not happen. It's really because we're in this early phase of cleaning, unlocking, and everything is all, like I just opened up the beehive and all the bees are, what the heck is going on around here, right? And so everything's, but once those bruises dissipate, you'll be able to do this roller a little easier without that happening. A wrong position would be that it was so high that your chin is down, right?
Okay.
When your chin is down and your neck is not going over it. I don't want it as low as it can be in your neck either. Kind of want it middle upper neck, and then you'll take your hand, put it on your forehead, and you press. See if you can get your head to sink into it. That makes sense?
Mm-hmm.
And then you try to put your hand back down, and hopefully your head will stay there. Does that make sense? It's like pressing
I see.
it's like pressing clay into a mold.
Yeah,
right?
exactly.
I want to press it into the mold, and then, and I feel like it tried to come back out of it. You're right, and the more you do it, the more the neck will stay in the mold shape, and that is your journey on this, is mastering it to the point where your neck just complies and wants to be curved. And like I mentioned earlier, just a little bit of left rotation. You understand, to get a little more pressure on that left side, on that knot.
And then do I put my hand?
You
in
can.
again?
I would just to help it press in. Does that make sense?
Yep.
And then see if you can bring the arm back down and it'll stay there. Push.
Sure.
And the more I work on you in the table doing this, I'd actually do this. I'd be holding you
Yep.
like that.
Dude, that feels amazing.
Right. But I can't sell you my hand.
No.
But that's what I'm trying to emulate. You understand? If I could
Yeah.
give you a perfect mold of this, I would just, for about 2 weeks in my office, I spend, a good majority of our time, aiming your neck, and then I would hold you like that. I'd have your head back and to the left. Like when I was massaging your neck earlier, I spent a majority of our time rubbing this left side. It is night and day. I think of Batman, Harvey Two-Face, one side's all mangled and one side's brand new.
Yeah.
Right? We have a massive asymmetry. I need that asymmetry addressed first. And so it's just, it's just molding. Just that. There you go. As we get your neck healthier, the chest, the lower back, all of that's going to follow. It's just, unfortunately, nobody's helped show you this knot on the left side. Like I said earlier, nobody's even noticed it, but it's gigantic. it's not a. It's like I walk in, this giant elephant. What? Anybody noticing that giant elephant over there?
Yeah, right.
What are you talking about, Ed?
Yeah, right.
I know. Oh, I can try. I'll try. We'll try again, but it is so fluid. It needs like an hour of just hold. I used to do when I was a teenager, I just work on my dad until my hands went numb. I would just be holding him like this, just squeezing and compressing the fluid out of the joint. This is again what the dental is trying to do. Obviously, it doesn't do as well as this, but it just hold. I want to hold this compression like that.
That is amazing.
I do that for the purpose, not for stretching. Sometimes you'll see people doing the pulling on the neck. I don't do that for any type of.
Yeah.
I do it to. When the vertebrae are compressed together, they can't rotate. So I'm trying to open them a little bit so they'll rotate. They get kind of paninied together, and then they won't move individually. I'm not trying to do that to... See, if I forcefully yank on you, do you understand how I'm just going to move the lower neck?
Yeah.
Right?
Yeah.
Which is the loosest part.
Yeah.
And I'm not going to move the stiff part. So I'm not doing this for... I'm not trying to move your lower neck. If it moves, if it's unfortunate, but I'm trying to unlock your upper neck gently so I can get this to move up here at the top. That's the purpose of that. it's just so much tension right there. Let it go. Let it go. There it is. A little bit. Yeah. Yeah.
Whew.
Yeah. That bone is not moving in a while.
Yeah. That's a two-step, man. That is crazy.
I definitely feel a lot looser.
Yeah.
There's definitely a lot less tension over here on the left.
Mhm.
I mean, obviously, there's a lot more work to be done, but
Yep.
I also like the you lifted the body
Yeah,
on the lower part and had that one pop right
Yeah.
there in the middle. I could definitely feel some changes and some good relief there. No,
Very good.
hey, appreciate it.
Good
Thank you
job.
so much. Appreciate it. Immensely, thank
You
you.
did awesome.
Appreciate it. Thank you.